Imagine a family of 4 struggling to survive on less than $25,000 a year. In Collier County, more than 20% of families are considered low income and are without health insurance. These often are working families who, at times, have to choose between putting food on the table and paying a power bill. These are the people who can't afford health care.
We have a very rich coastal population, and it peters out to when you get to Immokalee, people that are making less than $7,000 a year. When you have that particular mix, of course, you're going to have some people that are going to need some assistance along the way.
People would be really surprised how many uninsured there are in Collier County. In fact, Collier County is third in the state for the number of uninsured.
The Physician-Led Access Network of Collier County, or PLAN, is an initiative that evolved out of a program started by the Collier County Medical Society in 2003. Its goal? To provide a safety net of access to health care for the low-income, uninsured adults of our community.
Before we started PLAN, there was a huge void in the community for the non-insured patients. They sort of fell through the cracks. They would go to the emergency room and receive all their health care. This caused a huge problem for the truly emergent patients who then had problems getting into the emergency room.
In Collier County, there are over 40,000 low-income uninsured adults. PLAN gives us the organization and the opportunity to care for these patients and make a difference in their lives.
PLAN brings together doctors, clinics, hospitals, diagnostic and laboratory facilities, and other healthcare providers through an integrated system. Quite simply, it's a referral network that coordinates quality health care for the underserved.
So what PLAN does is offers them a way into the healthcare system to treat those medical problems without fear of not being able to pay their rent or their electric bill, that they can get their needs met, hopefully to help prevent long-term health problems.
PLAN does the legwork, screening and identifying eligible low-income, medically needy adults in Collier County.
I make sure that the office manager, first of all, realizes that she can always be in touch with me, and that the only thing that she really needs to do after she schedules the patient and the physician sees the patient is to keep me abreast of what she needs so that I can do it. Basically, that's it.
It's been a very, very easy process. I would highly recommend it to anybody. It doesn't take up any more of your time than scheduling a normal patient. And it's actually easier because we have the records and everything right there in front of me. I love those. I don't mind doing those. Those are the best because you have everything right there, right at your fingertips.
With more than 250 area physicians and other healthcare providers participating, as well as critical support services from all of Collier County's hospitals.
We've been able to get an awful lot of excitement out there in the physician community with this, but also bringing on just not primary care physicians, but also a lot of the specialties. So I'm extremely proud of that and pleased with how the medical community has come together around this.
This program allows you to do what you want to do, which is basically take care of patients without the burden of paperwork and everything else. At the end of the day, you can feel good about what you've done.
A small effort from physicians and their offices has a huge impact on the community.
They, the physicians, are the ones who are driving the program. In many communities, you'll have community health programs that are being facilitated by the different agencies in the community. This particular model is one where the physicians themselves come together and say, this is what we know we can do, this is how we know we can do it.
Who doesn't want to be part of the solution? PLAN provides solutions. Without PLAN, a large part of our community would have no other access to health care.
At the end of the day, physicians, like everyone else, wants to look back on their lives and say, look, I've had purpose, I've had worthwhile work, and I made a difference. And they want to do it for everyone.
Well, PLAN's a solution in that it's a private, nonprofit organization that represents the community through the physicians. This is run by compassionate people that care about the people that they serve, and everyone gives a little bit of themselves to be able to reach the goal of serving the underserved.